Welcome to Ayur Times. Today, we're looking into something really interesting. Panchakarma therapy.
Yes, it's an ancient system, deeply rooted in Ayurveda from India, going back thousands of years.
Right, thousands. And Panchakarma, that means 5 actions.
Exactly. 5 actions in Sanskrit. And the core idea really is deep detoxification. It's about clearing out accumulated toxins and, restoring your body's natural balance.
Let's dig into that philosophy. What's the main goal here? What's it trying to achieve?
Well, it rests on 4 key pillars, you could say. First is balance.
Balance of the doshas, vata, pitta, kapha.
Precisely. Restoring the equilibrium between those 3 fundamental energies. They govern everything, so getting them back in sync is crucial. Vata for movement, pitta metabolism, kapha structure, roughly speaking.
Got it. Pillar 1, balance. What's next?
Second is purification. This is about getting rid of ama.
Vama.
Yeah.
So it's toxins you mentioned, like internal sludge.
Yeah, essentially accumulated metabolic waste, undigested stuff that clogs things up and, well, can lead to disease over time.
Okay, so balance, purification. Pillar 3.
Rejuvenation. After the cleanup, the focus shifts to rebuilding. Nourishing tissues, strengthening the immune system, really building you back up.
That sounds vital.
It is. And finally, number 4 is holistic healing. It tackles the physical, mental, and spiritual aspects all at once. It's not just treating a symptom, it's looking at the whole person.
That holistic part really stands out. How does this compare to, say, a typical doctor's visit? Or even those quick detoxes we see advertised?
It's quite different. Modern medicine often focuses on managing symptoms, right? Which is necessary, of course.
Sure.
But a Panchakarma tries to find and address the root cause of the imbalance that's causing those symptoms.
Okay, so finding the why.
Exactly. Why the headaches? Is it excess pitta, vata imbalance? Let's fix that. And it's totally personalized.
Personalized? How so?
Unlike a generic cleanse, no 2 Panchakarma plans are the same. The practitioner figures out your unique constitution, your specific imbalances, and tailors everything just for you.
So definitely not one size fits all. That makes a lot of sense. Now, before these 5 actions, there's prep work involved, isn't there?
Oh, absolutely. The sequence is very important. It starts with Purvakarma. That's the preparation phase.
Purvakarma, what does that involve?
Think of it as softening everything up, getting the toxins ready to move. It usually involves dietary shifts, lighter foods, and daily oil massage, Abhyanga.
Abhyanga, right? The warm oil massage. How does rubbing oil on the skin help with internal toxins?
Great question. The warm herbal oils are chosen for your specific dosha. They actually penetrate deep into the tissues.
Really? Deep?
Yes. They lubricate, loosen those stubborn, deep-seated toxins, kind of freeing them up. Plus, it's incredibly calming for the nervous system, sets the stage, often involves some herbs too.
Okay, so Purvakarma preps the body, then comes Snahana and Swidana.
Correct. Snahana is next. That's oleation. Intense oiling, both inside and out.
Inside, you mean drinking oil?
Sometimes, yes. Medicated ghee or specific oils, often in increasing amounts over maybe 3 to 7 days. It saturates the internal channels, pulling toxins into the digestive tract.
Wow. And externally? More of Abhyanga.
Yes, continued daily massage with those warm herbal oils, really getting deep into the tissue.
Okay, so lots of oil. Then Swidana, that's heat, right?
Exactly. Swidana is therapeutic steam or heat therapy. After all that oiling, the heat helps open up all the body's channels, big and small.
Like sweat glands and lymph channels.
Precisely. It encourages those toxins, now loosened by the oil, to move towards the GI tract for elimination. The oil loosens, the heat moves, it softens everything right up.
It sounds very methodical, preparing step by step. Which brings us to the main event, the 5 actions, the actual Panchakarma. Can you walk us through those?
Sure. These are the core purification procedures done after the body is fully prepped.
Okay, number 1.
First is Vamana, therapeutic emesis or vomiting.
Vomiting. That sounds intense.
It is controlled, done under supervision. It's designed to eliminate excess kapha dosha, which often collects in the chest area.
Ah, so good for respiratory issues. Congestion?
Exactly. Chronic asthma, bronchitis, sinusitis, even some skin conditions linked to kapha. It's a deep cleanse for the upper respiratory and lymphatic systems.
Okay, what's the second action?
Next is Virechana. That's purgation therapy. Controlled bowel movements induced by specific herbal formulas.
So, targeting the lower digestive tract.
Primarily, yes. It's excellent for cleansing the liver and small intestine, and it's mainly aimed at removing excess pitta dosha.
Pitta, the fire element. So, good for acidity, inflammation.
You got it. Acid reflux, skin rashes, inflammatory conditions. Virechana helps cool that internal fire. Herbs like triphala or castor oil are often used.
Makes sense. What's the third action?
Then we have Basti. This is enema therapy.
Enemas.
Yes, but using medicated oils and herbal decoctions administered rectally. Many consider Basti the most important procedure
Really? Why is that?
because it directly addresses Vata dosha. And Vata governs all movement in the body, nerves, circulation, elimination. The colon is Vata's main home.
So balancing Vata there has wide-ranging effects.
Huge effects. It impacts joint health, mental clarity, sleep, the whole nervous system. It's foundational.
Wow. Okay, that covers a lot. What about issues higher up, like sinus problems or headaches?
That's where Nasya comes in. Nasal administration.
Putting things up your nose?
Gently, yes. After a facial massage and steam, medicated oils, sometimes powders or juices, are administered through the nasal passages.
And that helps the head area.
Directly. The nose is seen as a gateway to the brain and head. Naso targets disorders above the collarbone, sinuses, brain, eyes, ears. People often report amazing mental clarity, headache relief.
Better focus.
Definitely. Enhanced senses, clearing of sinusitis. It's like a reset for the head.
Fascinating. Now, there are 5 actions. What's the 5th? I heard it's less common now.
That's right. The 5th is Raktamokshana, or bloodletting.
Bloodletting, like with leeches.
Historically, yes, or venesection. It involved removing small amounts of blood to purify it, especially for certain skin or blood disorders. But you're right, it's the least common today.
So how do practitioners handle that now?
Often they substitute it with powerful blood-purifying herbs taken internally and other detoxification methods that achieve similar aims, but are, less invasive and generally safer. It shows how the practice adapts.
Okay, that makes sense. So after these 5 quite intense procedures, that it? Are you done?
No, definitely not. The phase after the main cleanse is crucial. It's called Panchakarma.
Panchakarma, what's the focus there?
Rebuilding and rejuvenation. After such a deep clean, your digestive fire, your Agni, needs to be gently rekindled.
Okay. So careful eating.
Very careful. It starts with a specific dietary plan, gradually reintroducing foods, often beginning with something super light like kachari, to rebuild digestive strength slowly. You don't want to overwhelm the system.
That's critical. What else happens in Panchakarma?
Often, Rasayana therapy. This involves taking specific rejuvenative herbs and formulations
To do what exactly?
to deeply nourish the tissues, boost immunity, promote longevity, basically replenish and strengthen the body after the cleanse, build resilience.
Nice. And lifestyle.
Yes, essential lifestyle modifications, integrating healthy routines, maybe adjusting daily schedules, mindful eating practices, appropriate exercise to maintain the benefits long term. It's about making it stick.
It really sounds like a complete system, beginning to end. So if someone goes through all of this, what are the big picture benefits they might experience?
The benefits can be really profound and truly holistic. Physically, you get that deep detoxification, clearing out stuff regular methods might miss, right down to the cellular level.
And that leads to?
Often, much improved digestion. Better Agni means better absorption, less bloating, more energy. People usually feel lighter.
More energy, less bloating.
Yeah.
What else?
Stronger immunity is a big one. Less susceptibility to colds and flu. And it can help with healthy weight management by rebalancing metabolism, maybe reducing those unhealthy cravings.
Okay, those are significant physical benefits. What about mentally and emotionally?
That's often where people notice dramatic shifts. A real sense of mental clarity is very common, like a fog lifting.
I could use some of that.
Right? Many report reduced anxiety, less depression, significantly better sleep quality, deeper, more restful sleep.
Better sleep is huge.
It is. And enhanced focus, concentration, and just a greater sense of emotional balance and calm. It really soothes the nervous system.
Wow. So who should consider this? Are there specific conditions it's especially good for?
A really wide range, actually. Digestive issues are common candidates. IBS, chronic constipation, acid reflux.
Okay.
Joint problems like arthritis, gout, where inflammation is key. Skin conditions, eczema, psoriasis, acne often respond well because it addresses internal roots.
Skin issues too. Interesting.
Yes. And stress-related problems, insomnia, burnout, chronic fatigue. It's great for calming the nervous system. Also, respiratory things like allergies or asthma, and even some hormonal imbalances like menstrual issues or thyroid support.
That covers a lot. Now, with such a powerful therapy, there must be things to be aware of. Side effects. Times when it's not advisable.
Absolutely. Good point. It's normal to have some temporary reactions during the cleanse.
Like what?
Maybe some fatigue, feeling a bit lightheaded, mild digestive upset. That's usually just the body releasing toxins. It typically passes in a few days.
But anything serious should be reported.
Immediately. Always report severe or prolonged symptoms to your practitioner, and there are definite contraindications.
Such as?
Pregnancy, especially the first trimester, is generally a no-go for most procedures. Also menstruation, acute illnesses like a high fever, severe weakness.
Right, you need to be reasonably stable.
Exactly. And certain medications might require modifications or postponement. It absolutely requires professional guidance and assessment. It's not DIY.
That professional guidance seems key. So if someone decides, okay, I want to do this, what's the lead up like? The preparation in the weeks before?
It's quite structured. Usually 1 to 2 weeks before you start cutting back. Less caffeine, alcohol, processed foods, any recreational drugs.
Cleaning up the diet.
Yes, and increasing water, getting more rest, letting the body ease into it. Then, maybe 3 to 5 days before, the diet gets simpler, easy to digest foods, and crucially, reducing stress. Lighter work schedule, fewer demanding activities.
Creating calm space.
Right. Then in the final 1 or 2 days, it might be very light fasting or a mono diet like just Kachari plus mental prep, setting intentions, and during the therapy itself, complete rest between sessions is vital and strictly following all the practitioner's instructions.
It really is a commitment, isn't it? A deep dive into self-care. What about modern science? Is there research backing up these ancient practices?
It's a growing area. Research is still relatively early compared to, say, drug trials, but there are promising findings emerging. Well, for example, there was a study back in 2016, I think in Scientific Reports, that actually found measurable changes in metabolic markers and inflammatory markers in people after they went through Panchakarma.
Oh, interesting. So objective changes.
Exactly. It points towards a future where we might see more solid scientific validation and maybe even more integration. Some hospitals are already exploring modified versions alongside conventional care. It's an exciting time bridging that gap.
That's a really comprehensive look at Panchakarma, from the ancient wisdom to the modern potential. It really underscores that deep connection between how we live, our internal state, and our overall health. So here's something to think about. In our world that often chases quick fixes, how might a deeply personalized, multi-stage system like Panchakarma offer a fundamentally different, perhaps more sustainable approach to long-term wellness compared to what we usually reach for? If this conversation sparked your interest, definitely subscribe to the Ayur Times channel to stay updated. And please share your own thoughts or questions in the comments section below. We really do enjoy hearing from you.